Hi everyone, this is your host Tracy Gartner and welcome to the Fertility, Pregnancy and Birth Summit, where you'll hear from experts around the world sharing how to boost your fertility, have the healthiest pregnancy so you can deliver a beautiful, healthy baby. It's an honour to have Amy Raupp here today. Author, acupuncturist, herbalist Amy is a women's health and fertility expert who has helped thousands of women on their path to conception. As well, Amy herself naturally and easily became pregnant by the age of 40 by following her own advice. Her mission through her teaching is to educate and inspire women, improve their health, celebrate their beauty and prevent disease, as well as increase their fertility. Amy is the author of 3 books, creator and owner of Amy Raupp Organic Beauty Products, and Amy has appeared on televisions in numerous national magazines and served as a spokesperson for several businesses. She is also a frequent health columnist and active blogger. So, Amy, you're very busy. Welcome.
Thank you so much, Tracy. I'm glad to be here.
Yeah, I'm glad to have you too. Amy, can you please tell us a little bit about your personal story and how you came to help so many couples conceive?
Well, fertility really started to come to me, to be honest. And with my scientific background, so I was a scientist before I was an acupuncturist, it spoke to me the most because it's a very measured end result, right? Either the patient is pregnant or they're not. And so that, probably in the beginning was really what inspired me a lot, was to really, see that measured end result and see the shifts in their hormone levels and in their menstrual cycles. And then, of course, my greater vision is creating healthy moms, or healthy women, I should say, that can get pregnant with healthy children and have a healthy pregnancy and bring them into a healthy and happy home. So I very much look at the whole fertility, process as a very holistic way to improve the world. That's my grander vision.
Yeah, wonderful. And certainly having your own personal experience is a massive learning curve, isn't it?
Oh, it's amazing. So I wrote my third book, Yes, You Can Get Pregnant, when I was 38 and had yet to, even actually meet my husband. So I was somewhat writing it for myself as well, because the subtitle is like Natural Ways to Improve Your Fertility Now and into Your 40s, knowing that I would likely be, I would be conceiving later in age, and that was my hope. I never gave up faith in my body or my ability to conceive. And so I wrote the book 2 years prior to my own becoming pregnant, at the age of 40. I delivered him 2 days before my 41st birthday. So, and we very much plan to have a second one, or at least try, and I have great faith that my body will do it. So it's wonderful to have a personal experience now. It really puts me professionally in a different realm, too, because for the last 10 years I've been helping women conceive without having ever gone through it myself, and now having conceived on my own and carried a pregnancy and, really lived my message, not that I hadn't in the past, but really lived it through a pregnancy, if you will. I really see the results and how well you can carry this whole lifestyle and concept into motherhood, and that it helps you so much. It really sets the stage for raising a healthy child and maintaining a healthy marriage or partnership and, and a healthy home all together. So it's extremely rewarding.
Yeah. I find that, of course, in an ideal world, preconception care is perfect. But also, if the parents have a really good, solid diet before they fall pregnant and Bubs comes along, then they can teach this to their child. Often I find parents trying to fumble their way through trying to get their child's diet strong, but their diet, their foundations aren't there. So I think this is another wonderful opportunity to really impact your child's health.
That's really my part of that grander vision I was discussing. it's this idea that we're already in tune with our bodies, right? Not just nutritionally, but physically and emotionally, spiritually, and that we can then easily teach that to our children by leading by example, rather than do as I say, not as I do, which is, the complete opposite of how I would like to parent, So, and I feel very fortunate, if you will, that I had developed this preconception plan, 8 years ago, and I've been following it for that many years, which is probably why I became pregnant so quickly, that I had that much time to really prepare my body, if you will. And yes, it's my, my mission with anyone who finds their way to my practice. Ideally, I get them at preconception, right, before they're really going to start trying. A lot of times I get women who are already in the midst of trying, but I still get them to maybe give me the 3 to 6 months that we can really prepare their bodies. And I always tell them that to not worry about, age or timing, because we're actually, the lifestyle changes we're incorporating are actually going to fight the aging process and make you healthier and younger at a cellular level. So, but this idea that, we really work on the mom, or the mom to be, and her relationship with herself, her relationship with her health, her relationship with her partner, and that then leads to such a healthy, beautiful pregnancy and, raising of a child.
Yeah, beautiful. So what can women do to prepare themselves to get pregnant?
Well, again, to be redundant, the preconception, I think, is extremely important. So with that, I mean to ideally you start preparing your body and your mind and your home, if you will, for about 6 months before you want to conceive. And so that means, like, if you're on the pill, I want you to go off the pill at least 6 months before you're ready to conceive, ideally even 9 months, because it can take that long to, regain a normal ovulatory function after going off the oral contraceptives. Nutritionally, to, as I would say, eat real food, and we can get into that a little bit, and then emotionally to get to this place where they love themselves first. They put their health first as a priority. I think that's extremely important, because if you just do that, then the lifestyle really just blossoms from there. It's very easy to make choices that support your path to fertility and conception when you're in a state of loving and respecting yourself and your health. And then also to go into things like detoxing your bath and beauty products, as those are major culprits in the world of infertility. And then shifting, also what you use to clean your home, obviously the food you bring into the house. And then also a big piece that I work on and encourage other women to work on, and it goes along with the self-love piece, is tuning into the inner dialogue within your own head and being kinder to yourself, a lot more love and forgiveness towards yourself. And that, and I'm a practitioner of acupuncture, which is a branch of Chinese medicine. And so in the world of Chinese medicine, we see, the uterus, as we call it, the child's palace. And we have this belief that it's a woman's job to make the palace hospitable for a child to want to live there. And that hospitable nature is the mental, emotional plays a very strong role in there. So if a woman is, has a lot of maybe self-hatred or, just a lot of internal emotional chaos, it's really important to work through that before inviting another person to live inside of you, right? You want to create a very peaceful, loving environment for them.
So what did you say in traditional Chinese medicine the uterus was called?
The child's palace.
Power.
So isn't that beautiful? The actual translation for uterus, it's Qigong, and the translation is child's palace.
Yeah, beautiful.
So we have the saying that you need to prepare the palace before you get pregnant. So that is the preconception period. And in that preparation, it's not just about nutrition, it's also very much about the spiritual, emotional component. We see a direct connection between the heart and the uterus in Chinese medicine. There's this this vessel that runs between them that we see, and it needs to be open, and we say the heart needs to be filled with joy and love, and that penetrates the uterus and creates a very loving environment for the child to grow in. So when there's a lot of sorrow or trauma or fear, which we do see with women who are going through fertility challenges. So that's why I think I focus a lot on that work, because I really want to get them back to that space of feeling more joy than despair, or joy than sorrow. But opening up that vessel and really filling the heart with joy and love fills the uterus with joy and love and makes the uterus, the palace, if you will, much more palatial and hospitable.
Yeah, that's great information. And what I find is that once the mother has had the child, that it's all about looking after the child and the house and the husband, and they really put themselves last. Mm-hmm. And it takes often years for them to get back around to looking after themselves, usually when they're at rock bottom and they're completely drained, fatigued, and possibly more health issues coming on board for them. So I think if we can really get this self-love and caring before we fall pregnant, then this is perfect, isn't it?
It is, and that's the beautiful thing. If that's in place, then it really does become easier. I can use myself as an example because I'm in it, right? My little guy will be 4 months on the 1st, and I was able to come into the pregnancy into new motherhood, with a lot of love and care for myself, and the ability to ask for help, to not feel guilty about having help, to also honor that I need to work to afford the help, of course, but that, and so even when I come home late from work, or, maybe he's asleep, or, we only get, an hour together before he goes to bed, how I even manage the guilt, I find, because I've done so much work on myself, that I can really talk myself through it very quickly, where I just, and I even say it out loud to him, like, this is best for Mommy, this is best for the family unit, that Mommy maintains her identity of who she is. And that's good for Mommy and Daddy. That's good for you growing up. You're fostering independence. I'm fostering independence. That you can actually see it. Like, I can step back. And that's probably an age thing, too, right? I'm fortunate in the sense that I am 41, so I've lived a lot of life. I can have that wisdom, if you will. But so much of that is rooted in the self-love that I've been working on. And then even the health, and I see it, like, in my breast milk, and how abundant that is, and how much she's flourishing and growing, and that's because of my diet, right? And the bath and beauty products that I don't use in the home, so he's not exposed to any of these toxic chemicals, and that there's just this balance that it's already a part of my life, so it's very easy to bring it into the home and just, not make all these massive changes when there's a huge, massive change, which is a newborn child going on in your life,
And I think for those women that are in that preconception stage, or maybe those that have struggled to conceive, that this is a beautiful thing to be working on whilst you're trying every month, because I know it can be a real struggle for some couples. And if you know that you're really nurturing yourself and you're going to be in a better place through this journey, it's something to really look forward to in a way, as opposed to feeling the dread of not being able to fall pregnant. Can you give us a little exercises that we could be doing to get in touch with joy and love?
Well, so I am doing this fertility coaching. I'm doing this online fertility coaching now that I just launched, and we are working through some of the exercises, so it's actually perfect timing. So I was actually just writing some. The first thing that I really encourage is the mindfulness practice, right? So whether that's a meditation practice or just, a practice of tuning into the internal dialogue in your head and getting comfortable with that conversation, even if it's not a very nice conversation, which unfortunately, for a lot of women, it isn't a very nice conversation that goes on in their heads. You know, it's more of a conversation of you should have done it this way, you waited too long, you know, you don't treat your body well. You know, it's a lot of self-deprecating talk. And so to tune into that conversation and then to start to combat it is what I recommend. So to start to say, you know, to yourself, well, I'm doing the best I can do. You know, I'm collecting information, you know, even for women that are a part of this summit, right? They signed up for the summit, you know, so they're taking a step in that direction. So give them credit for these steps that they're taking, and to just start to really nurture themselves. And you know, I said it in my first book, I think, in Untitled and Get Healthy, but to tune into the conversation, and if you wouldn't talk to your best friend that way, then you better not talk to yourself that way. So I think that's a really important first step, and we can't get to that first step if we don't have a mindfulness practice, because we just don't allow ourselves to slow down enough to hear the conversation, right? So a brilliant exercise, of course, is meditation, and I know some people get overwhelmed by the idea of sitting and meditating for 15 minutes or so, or thinking that they have to become enlightened, and I always say it's not about that at all. You know, it could really just be a couple minutes a day where even at the office, you know, if you have a door into your office, and you can close it and just take a couple deep breaths, and as I call it, like chill out and check in with yourself. You know, how are you feeling today? What are you saying to yourself? You know, or keeping, you know, one other thing that women really love, and I've gotten great feedback on it, is keeping a gratitude list. So that's a great way to just focus on the wonderful things already present in your life. So you're shifting your focus away from the things that are missing to the things that you are grateful for. And it could be very simple. It could be, you know, I'm grateful that I'm having a good hair day. You know, it could be that simple. It could be really profound, you know, that, you know, you're grateful that you found your soulmate, or, you know, whatever it is. But to just start tuning into the things in your present, current life that you are grateful for. And I recommend, you know, paper to pen exercise with that. So you're, pen to paper exercise. So that you're writing that down. And, you know, 5 things a day. Keep it really simple, but it's a beautiful way to start your day. And then that way you shift your mindset right away to the gratitude aspect. Another beautiful thing, and this is something I'm encouraging with all my clients, is to remember a time when there was a lot of joy in your life, and what were some of the hobbies that you were practicing then, and if you could maybe get back to one of those. You know, like a woman recently in my group, you know, took piano lessons. She started taking piano lessons again because it's something that she really loves to do, and she just lost sight of it, if you will. And another one is painting, you know, another one is writing, and just taking some time for you to really cultivate these practices that will get you more in touch with joy and happiness in your life. And then even in your relationship, you know, if you are in a partnership, to really celebrate what you guys already have before having children, you know. And also, if you can go there, I know it's challenging, the things that have developed, you know, through your challenges of getting pregnant. You know, have you guys gotten closer? Have you, you know, discovered more things about each other? Do you feel more nurtured and supported by your partner? You know, to just start to look and find there is so much in our, you know, current life to celebrate. And I think, you know, what happens a lot, especially with women trying to get pregnant, is they put their happiness aside and they say, well, I'll be happy when I get pregnant. And we really need to shift the focus back to being happy now. And then, you know, the pregnancy as, you know, a beautiful bonus, if you will.
Yeah. Fabulous tips there. Thank you very much. I just wanted to touch base quickly on what some tips you have dietary-wise to aid fertility.
So I think I call them my 6 big no's in my book, Yes, You Can Get Pregnant. Quickly, they are no soy, no gluten, no sugar, or just no added sugar. Keep added sugar below 15 grams a day. No artificial sweeteners, no genetically modified foods, and no pesticides. So, and quickly on the soy, it's just extremely processed and typically genetically modified. If you can find organic, sprouted soy products, or you're making your own soy milk or tofu, which some people do, that I support, you know, but again, in moderation. I wouldn't have more than 3 ounces twice per week, just because of soy's estrogenic activity, and it can just disrupt hormones. And then with gluten, I know it's a bit of a fad, it seems, these days, but there is a lot of evidence that, especially in the United States, we genetically modify and have done our wheat for 30, 40 years now, and that modification is seeming to trigger autoimmune illnesses. And if you kind of look back and look at all the current research on infertility, most of the cases are unexplained infertility, and they tend to, if you dig deep, fall into an autoimmune category. So if there is any autoimmunity going on, or you just haven't been able to conceive, I really urge cutting out gluten, or at the very least going to organic, non-GMO wheat products.
Now, going back to the autoimmunity,
yes.
So I would say a lot of people never get a diagnosis of an autoimmune condition, but yet I think there's a lot of people that are challenged by immune dysfunction. How do you identify that in your patients that
yes,
could be?
I agree. It is a true challenge. The diet that I wrote in my book, Yes, You Can Get Pregnant, is an autoimmune diet, to be totally blunt and honest, because I've decided that 80% of the women that are having trouble getting pregnant, it has to do with autoimmunity, maybe even 90%, because you can look, PCOS has autoimmunity characteristics, endometriosis has autoimmune characteristics, thyroid diseases, a lot of them are autoimmune, undiagnosed, Hashimoto's, if you will. So those three disease states alone are the main cause. If you looked at all those, that's probably 90% of the population that's trying to get pregnant and not having an easy time with it. So for me, I'll first just clean up the diet, and that, will often alleviate the health-related symptoms. So not even fertility. Like, I'm looking at health. So I'm looking at, do you have eczema or psoriasis? Do you have gastrointestinal issues? Do you have anxiety? Do you have insomnia? Those, to me, are all actual potential identifiers for autoimmune illnesses. And if they get better when you change your diet, then I definitely think there's autoimmunity going on, because whatever you're eating, and especially if you're not eating a real food-based, nutrient-dense diet, the foods you're eating are triggering the immune response in your body. And then also if there are habitual miscarriages, for sure. If there's more than one miscarriage, subsequent miscarriages, meaning you did not have a healthy child in between, I assume autoimmune issues as well. And I will then recommend blood work, so always looking for thyroid antibodies. If the doctors will test, I'll look for autoimmune markers like IgG or IgA antibodies, natural killer cells. I'll have them look at a complete blood profile, so we're looking at clotting factor disorders, we're looking at MTHFR issues. Those all fall into autoimmune categories. And so, there are ways to identify. There's a lot of, unfortunately, at least, in New York City where I work, there's a lot of doctors that poo-poo the whole autoimmune idea, but then there are clinics that are completely dedicated to treating autoimmune issues and infertility. And there's a lot of research out there to support this autoimmune component. So I go about it really, like I said, diet first. I want to see what changes happen. But if I've gotten a woman who's maybe already made the changes, has had some miscarriages, or still struggling to conceive, I'll push for further blood work. Now, I can't run the labs myself, practicing in New York, but some California practitioners can. It depends state by state in the U.S. And send them to maybe a functional medicine doctor, where we can look and dig deeper into the autoimmune components. And you can test for them. And then at that point, there are things that we can do. It's just going longer on the diet and on the lifestyle changes, meaning 6 to 9 months to really lower the autoimmunity. And again, you'll see the changes in their health overall, digestion, skin, sleep, emotional states, etc. So
And with the natural killer cells, do you look for a uterine biopsy for that, or are you doing blood work?
Both. You can do it on blood work, and then if the levels are really high, then there seems to be quite a link between natural killer cells and endometriosis. So you can have them go in, and I have one doctor in New York City, Jeffrey Braverman, that his approach, if natural killer cells are very high, that he's positive there's endometriosis, he will go in and do like a uterine biopsy or even clean out the endometriosis, and that should then lower the natural killer cell count, and the woman should then be able to get pregnant before the endometriosis comes back. But now that the laser technology with the surgeries, the endo typically doesn't even come back. They cauterize. I'm not a huge fan of surgery. I like to go about it in more natural ways, but I did just have a client go through that exact scenario, and I'm very optimistic that she will not have another miscarriage. I mean, she's had 4 before she met me. I met her right after her 3rd miscarriage, and we finally got all of this blood work and everything done, and sure enough, I mean, her autoimmune, profile is off the charts. And she was with another fertility clinic, a very established, well-known fertility clinic in New York City that never looked under this rock, so
amazing.
It's something to really look into, especially if you've been struggling for a while.
Yeah, and I think if you are with a fertility clinic, I think it is really imperative that you're teaming up with someone that is outside, that you can bounce off ideas, is holistically minded, because I see so many women going through fertility clinics and just having so many things missed because, I think fertility clinics are just looking at, okay, let's do IVF, and I can't really explain why they're not looking at some very basic,
obvious, yes, I agree.
Obvious issues.
Clotting factors is one of the biggest ones for me. MTHFR, another. I mean, and that's the bigger role I see myself playing, right? I'm a coach, if you will, and and I'm sure a lot of the practitioners that you're having, at this summit are as well. It's I help bridge that gap for them. I provide the support and then the direction. Like this woman I'm talking about, she didn't have any direction, and she's seen every doctor, that she was recommended to in New York City, and no one was giving her any advice. And then she comes to an acupuncturist, right? And then I have all this, and I send her to the doctor, and she gets the blood work. And so, I almost become a liaison, and that's what you want. And, you need the support, and you're unfortunately, and I should say it's atypical to get it from your Western doctor, your fertility doctor, because they're just too busy. It's not that they don't care, have compassion, but they just don't necessarily think outside the box, and they don't really have the time to dedicate to your individual case. So, and it's also, my other recommendation is if you're with the same clinic and not having success, switch clinics. Get a third opinion, not just a second opinion, a third opinion on your case. Ask lots of questions, do lots of research. You have to be your own advocate. And, and if it's not working, like, they better be changing a protocol. It's like that's what you want from your doctors. You should expect them to be changing and really looking at every piece of your puzzle.
Yeah, absolutely. Now, when, if someone is wanting to have some surgery, I just wanted to point out, I think it's really important to do your groundwork and find a good surgeon.
Yes.
Now, just wanted to touch base on diet advice for the male.
Okay. So it's still very similar. The diet that I recommend, I would love for, both partners to do it, right? Because it is about this idea that we are creating a healthy, happy home for that baby to come into, right? So it's great when dad can support mom and her dietary changes. But in addition, it's important for men to get in, amino acids, antioxidants, omega-3 fatty acids, and vitamins like zinc, selenium, vitamin A, B12, and C all seem to really help improve sperm quality. So, I still, within my diet, I recommend doing bone broth on a regular basis, which is basically, homemade chicken soup or beef stock that you cook down for, 12 to 14 hours. But it has a complete amino acid profile, so a great nutritional, food for men and women, but men as well. If we're talking about the male factor, is this bone broth, which has like every amino acid under the sun, and then it also has the minerals and some vitamins like selenium and zinc in there. And they can also do things like, I'm a fan of eating animal products. They just have to be organic and grass-fed, but liver is another amazing source of zinc, selenium, vitamin A, B12, all of which are amazing for sperm. Brazil nuts, another great source of selenium. Pumpkin seeds, another great source. So to incorporate some more selenium, zinc, vitamin A rich foods into the male diet really helps with the sperm quality.
Yeah, that's wonderful advice. One of my favorites is liver. Making your own pate is a great snack. Getting a celery stick or something like that for morning or afternoon tea.
Yes, I also recommend. I was just going to say, because a lot of people are squeamish about liver, although I'm with you, I love pate. I recommend taking it in pill form. You can get grass-fed liver that's desiccated and in pill form, and you can take it daily. So that's another great way to do it,
Yeah, I agree. We don't currently have anything like that here in Australia, but I know you can get it online. So
yeah, you can get it online. Because what I get is from New Zealand, the stuff that I recommend.
Yeah, that's the one I've seen.
Yeah.
Oh, great. And another one for males is I often find they're not getting enough protein.
Yes, for sure. And that's, across the board. I think it with women, too, because if there's hormonal imbalances, there's blood sugar issues. And basically means you're not eating enough protein. You need to eat protein, and this is male and female, something within the first, I say, 30 minutes of waking. So it could just be a handful of nuts, like 3 or 4 nuts. For men, Brazil nuts are great. And then needing to eat every 2 to 3 hours, and there has to be protein with every meal. So, and then sometimes, too, eating a little bit of protein before bed is actually really good, especially if you have some sleep issues, so male or female, like, again, a handful of nuts. Nuts seems to be the easiest if you don't have a nut allergy. Otherwise, something like hummus would work, or even a little avocado. It's not so much protein as it is fat, but still, will help level up blood sugar.
Beautiful, yeah. Now, I wanted to ask your opinion on age-related fertility issues.
Mm-hmm. Yeah, obviously I got pregnant at an advanced maternal age and was never worried about it. I do see a lot of women in their mid-40s in my practice. That tends to be, my demographic I think is 35 to 45 in my practice. So 40 is kind of young for me, in my opinion, in my practice. The research, there are small studies, but they're out there, and I quote them in my book, so I'll loosely quote them now because I don't have my book in front of me. But basically, the studies show that, we're told that our fertility after the age of 35 declines significantly, right? There's basically like fertile cliffs that you fall off of once you turn 35. And that your ovarian reserve declines and your ovarian quality, your egg quality diminishes severely. They say that it goes down to about like 30% of women over the age of 35 will get pregnant after 1 year of trying to conceive. But the research shows the opposite, meaning on the other side that about 80 to 88% of women aged like 37 and higher, I'm just kind of grouping a couple of studies, conceive within 1 year of trying. So the two keys in the study were not just sex around ovulation, but regular sex. So meaning sex outside of ovulation, but like 2 to 3 times a week, and then obviously making sure you're having sex around your fertile time. And, I think the lowest percentage was 78% of women over the age of 40 got pregnant after 1 year of trying. That's still significantly different than the 30 to 35%. So just keep that in mind, because you also have to remember that even a 25-year-old couple with everything, youth and everything working perfectly, it can still take a year for them to conceive. So it's not that big of a difference. It's about, like, I think if you're looking on the max end, it's like an 8 percentage points difference between a 25-year-old couple and a 42-year-old couple. So I really discourage the concern over age. What I do encourage is, the lifestyle changes, because that does fight the aging process. And, even though we are born with all the eggs that we have for our lifetime, or so we think, there's some science that questions that, but it's more about the environment with which those eggs mature in. So you have all of these eggs, sitting in your ovaries, if you will, but the process of folliculogenesis, which is a 100-day process of when the egg that you're about to ovulate, say this month, has been growing and developing inside of your body for the last 100 days. That maturation period, that 100 days, that egg is influenced by all of the internal environment in your body, which is influenced by your diet, by your stress, by, the toxins in, your bath and beauty products. So to know that, yes, all your eggs are there, but you can improve the quality. So I don't really care so much about quantity. I really care about quality. And we can for sure improve egg quality. We know that. There's science that says we can, there's proof of that. So even if, and I can have a woman at 25 have a diminished ovarian reserve, and a woman at 45 have plenty of eggs left. So, to not get too caught up on the age-related issues, and not even to get too caught up on your FSH or your AMH, because FSH is no longer a gold standard. It tends to be changed month to month. But even AMH, if it shows that there's a low ovarian reserve, we're still not dealing with only like 4 eggs. We're still dealing with at least a couple hundred, I would say, and we can definitely improve the quality of that. So worry less about your age and more about your overall health.
And is there any supplements that you would recommend to help improve that environment the eggs are developing in?
Yeah, so of course, going back to diet, that is my hugest, supplement, if you will. That's the best place to get all our vitamins and minerals and antioxidants to improve our health is a nutrient-dense diet. Namely things like liver and bone broth. Those are 2 of my, secret weapons for fertility. But in addition, there are some supplements out there that optimize the health of the mitochondria, which are basically the powerhouse of each one of the cells in our body, and we're made up of, I would say millions of cells. I think I'm right on that, or at least hundreds of thousands of cells. And when you improve the mitochondrial function, you optimize the health and the age, if you will, of the cell. And so I recommend, there's a brand, Life Extension, and they have something called the Mitochondrial Optimizer. So most all of my patients are on that. I also like spirulina, or blue-green algae, which is a superfood. There's been some studies that show wheatgrass, which is also in that blue-green algae super green category, shows to improve egg quality. Of course, fish oil. I prefer cod liver oil over regular fish oil because of the fat-soluble vitamins, but the fat-soluble vitamins, namely A and D, really help seem to improve quality. There's some antioxidants. Inositol is one of them, myo-inositol, which there's some studies that shows that it improves embryo quality from IVF to IVF, so we assume that egg quality has improved, and sperm. That inositol is naturally occurring in liver, so that's where I go back to my liver recommendation. But you could take an inositol supplement, and then melatonin is another antioxidant that has shown some improvement of egg quality. And so you could do a melatonin supplement. There's some good ones out there. I think Natural Health Institute is the brand that I like the best. It's called Herbatonin, Herba tonin. and that's kind of the regimen that I usually recommend.
Yeah.
You know, and then along with the diet, you know, and like I said, namely the bone broth and the liver, eating eggs, you know, grass-fed animal products, watching your pesticide load, all of those things really seem to improve egg quality and sperm quality.
Yeah. Now, you mentioned inositol. Did you say for sperm as well?
Yes, for sure.
Okay, great.
Again, those
and I know it's very dose dependent.
Yes.
What sort of, how many grams are you recommending?
Yeah, see, that's a good question. I don't, off the top of my head, have an answer. I think it's about like 10, micrograms. I think that's a good dose. But I usually just recommend it getting it from liver, you know, as a food source. And then there are some girls that will, in addition, take the inositol. There's a supplement out there called Ovasitol, I think. It's OVA, is that it? Yes. That one doctor I was talking about, Dr. Braverman, who does all the autoimmune work in New York City, he recommends that to women. So that's his form of inositol. And you would just take that as directed. Yeah.
And any supplements for sperm health?
Again, it's the same. I really think, you know, egg and sperm, you know, respond to similar. So it's going back to the antioxidants. What I do see with men, what really seems to work well for improving sperm quality is the blue-green algae. They can do, I've seen dramatic changes in sperm with men who take, there's a brand out there called E3 Live, and they sell liquid green powder. Well, it's like liquid green, I guess juice is what you would call it, but you take these shots of it, so it's really concentrated.
Okay.
It's almost like a wheatgrass thing, but they're concentrated blue-green algae. And I've seen in like a 2-month time frame of a man taking that regularly, absolutely dramatic changes in their sperm.
Yeah, wonderful. It certainly helps alkalize the body too, which is really important.
Yes, exactly. That's it.
Can you elaborate a little bit more on our skincare products?
Yes. You know, there's a lot of lists out there now. I think there's like 12 or so ingredients we need to avoid. The big ones are things like parabens, sulfates, polyethylene glycol, DEA, what seems to be, and BPA, of course, in plastics. These chemicals have been shown scientifically to be endocrine disruptors, so that means they disrupt our hormone levels. They also have, most of them, been shown to be cancer-causing agents as well. And unfortunately, they are in like almost every bath and beauty product that's out there. So what you have to do is just revamp your entire bath, beauty, makeup, skincare, hair care routine. I recommend what women start doing is there's 2 wonderful apps or websites. One is Skin Deep, which is from Environmental Working Group. So if you go to ewg.org and go to their cosmetic database, you can actually search your products and see how they rank on toxicity level. And they rank them by cancer-causing agents, reproductive harmful agents, and allergens. And I recommend staying under a 2 for all of your products. And there's another app called Think Dirty, which you can download on your phone, and you can literally scan the barcode of products, and it gives you, you know, it's not all of them in the database, but there's a lot that are, and it gives you a ranking of the toxicity of the product or the harmfulness. And so, you know, most of us don't realize that our skin is our largest organ. Anything we put on our skin gets into our bloodstream, and these substances disrupt our hormones and can exacerbate, you know, our conditions. And then furthermore, one step is once you are pregnant, you put them in your skin, they affect your baby. And there's a lot of science going on right now about like early exposures. They call it fetal exposure. So while they're in utero, and the harmful effects of that on the health of your child for the rest of their life. You can undo the harmful effects, but it's basically by avoiding, and detoxing, if you will, your body from all of these products. But if your baby's exposed in utero, it definitely can cause some health conditions in the future and hormonal conditions, so reproductive issues in your child. So just things to really research, and you can use those apps, like I said, and even I don't have a whole list committed to memory, but I have it for sure in my book, and I think there's 12 that I list to avoid.
I think it's a really good opportunity, again, to clean up your lifestyle. So when bubs comes along, they're not exposed to all these chemicals. We're just flooded with or bombarded with so many chemicals these days. Mm-hmm. If your home can be clean, there's one thing we can control.
Well, that's it. You can control what goes in your mouth, and you can control what you put on your skin, right? And you would be so amazed at just changing those two things and how you can dramatically improve your health and your fertility. I always say it's like my job isn't to help get you pregnant. My job is to optimize your health, and your fertility is an extension of your health. So that's really how I see it. And I think that's how, especially women who are in the challenge of trying to conceive right now, that we were saying earlier, that if we can shift the mindset that we're really just trying to improve our health so we can feel better and, for vanity reasons, look better, sleep better, know that your fertility is improving as an extension of that,
Yeah, absolutely. We're going to have to wrap it up.
Yes.
It's been awesome chatting with you. I could chat with you for hours. But, yeah. Is there anything else you would like to add before?
Well, one thing that, we touched on a little bit in the beginning, the joy-love component, but also, I have this mantra throughout my book that I think is really important, and it is that you basically don't lose the faith in your body. I believe that my body, has the, I can improve my health and change my fertility, so to have that belief system and to not waver in that, to believe that you can do this, to feel empowered, not disempowered. And there's so much that is in your control. So, I encourage you to do the research and to really focus on optimizing your health, because you do have the power to change your health and improve your fertility.
Yeah, thanks, Amy.
Sure.
Now, I know that you've got a free gift to offer listeners. Can you tell us a little bit about that?
So, I've mentioned it a couple times. I'm going to give away 3 signed copies of Yes, You Can Get Pregnant, which is my book on improving your health and your fertility. And so what I want listeners to do is you need to first like my Facebook fan page, which is Amy Raupp, MS L.A.C., which, I'm assuming we'll send out in an email, my Facebook fan page, and then also to go to my website, AIMEE'S.com, and sign up for my newsletter. So I'll pick 3 people who do both of those things, and I will send you anywhere in the world signed copies of Yes, You Can Get Pregnant.
Wonderful. Yeah, that's very generous. Now, did you want to share about a little bit about what you're up to at the moment?
Well, so right now I'm working through some ideas, if you will, but the concept of I have a cookbook that I'm working on, which is all about nutrition for improving health and fertility, and then a book that will likely go along with that cookbook, which will be more about the nurturing ourselves, mothering ourselves aspect of putting ourselves as priority number one. And now that I am a mother, I can kind of see more into that, as you were saying, how you can lose touch with who you are and put everyone else first. And so to come back and hone in on taking care of ourselves, especially from this spiritual and emotional part, and then letting our health flourish from there. And again, leading by example, parenting from a place of self-love, optimizing our health from a place of self-love. So that is in the works as we speak.
Yeah, very good. I look forward to seeing it. And I'm certainly going to like your Facebook page and sign up to your newsletters. Well, thanks for your time, Amy.
Sure, thank you so much.
Yeah, our listeners are going to get some very valuable information out of this interview. And, highly encourage everyone to get over to Amy's Facebook page and sign up for her newsletters. And you've also got your skincare products that can be accessed as well.
Yes, thank you.
We'll say bye for now.
Okay, thank you so much.
Thanks, Amy. Bye.